Hi, it's Kyron at Body Escape Massage Center. Calf muscles, the back of your calf. Three muscles, plantaris, soleus, and gastrocnemius. For our purposes today, we're only going to separate them into two groups. The group that crosses the knee joint and the group that doesn't. Both of them cross the ankle joint, so they do help you do this. But the gastroc also helps you do this, which is flexion of the knee. So a bent knee position is going to isolate and stretch your soleus and plantaris better than a straight knee position, which would also be stretching your gastroc. So plantar fasciitis, a lot of times people that have the pain at the bottom of their foot in front of their heel, there's associated tension in the calf muscle, and that needs to be worked out. It's also associated tension just in that whole complex of ankle plantar flexors. So having those stretched out is going to sometimes alleviate some of the tension and pain you have on plantar fasciitis, or it could be a trigger point referring us to that area. So it's good to know what you're dealing with. First stretch we're going to do is a plantaris and soleus stretch, and you're going to want to have on hard sole pair of shoes. Tennis shoes are fine, just make sure they're tied up tight, and a vertical surface that you won't mark up, like a door jamb or something. You don't want to use drywall or something like a white painted area like a garage door or something. So I'm going to stick my foot up against the wooden surface, and I'm trying to get my toes to point as close to vertical as possible. So I'm going to try to get my heel as close to that surface as I can. My knee is straight, toes pointing up. Now I'm bending my knee and pushing my knee towards the vertical surface. I'm also pushing downward into my heel. And you'll feel that one more in the lower part of the calf muscle, down towards the Achilles and ankle. Once again, I'm going to get in as close as I can so my heel is as close to the vertical surface as possible. My toes are pointing up. And I'm going to bend my knee and press towards the vertical surface. Downward pressure as well. Now I can, it's a little bit, to advance the stretch further, I can straighten my knee out, but you can see that I'm leaning forward and bringing my hip towards the vertical surface as well. That's going to stretch more of your plantaris, which is along the outside here, if your knee is locked. So when my knee is bent, soleus is getting stretched and the plantaris. And then when I lock it, I can feel it more on the outside along the fibular head. Okay, so those are the ones that do not cross the knee joint. Gastrocnemius, everyone's probably seen this stretch before. A lot of runners do it. Vertical surface, you can use something waist height. I think it's easier to use shoulder height because you can keep good form this way. Arms length away from the vertical surface. Keeping my back straight, I'm going to stick my foot back as far as it'll go, and then bend my support leg until my toe touches. Now, as you can see, my heel's not on the ground yet, but my hands are still touching. Now I'm just going to lean forward and using my hands, press my heel towards the ground. And I feel that stretch through the entire back of my leg. Knee is locked, and I'm using my hands to push away from the wall and down into my heel. Once again, arms length away, keeping my back straight. Don't do this, that's no good. Stick your foot back as far as you can and bend the support leg. And my heel is not completely pressed into the ground until I force it with my hand pressure. Important thing to remember is stretching is a cumulative effect. You are not going to get rid of all of your problems stretching once. or stretching only on one day. It needs to be repetitive, just like anything. Exercise, trying to learn a new language, anything. You have to keep practicing. And the more you practice it, the better you'll get at it. Hopefully this stretch will work for you, and you'll have less foot and ankle pain, and be able to continue doing what you do. If not, you should probably get a massage. I'm Kyron, Body Escape Massage Center. We'll see you next time.